some movement are taking place, rolling and gliding that we cannot see. That aspect is the arthrokinematics aspect. Okay, that is the arthrokinematics aspect. So let's have a look again. So this is further describing the osteokinematics. The osteokinematics is the normal physiologic movement, normal range of movements. And basically there are 6, isn't it? Flexion, extension, abduction, adduction, medial and internal rotation. There are 6 possible movements. Every other movement could be a combination of 1 or 2 of this basic one, of these 6 basic. And there are 3 planes of movement. There are 3 axes of movement. I think we know this one from our basic kinesiology. So all this range of motion thing, they are osteokinematics. All right. However, arthrokinematics, what about arthrokinematics? They are the movements inside the joints. They are movements of bone and bone surfaces, but right inside the joints. And by nature, all these arthrokinematics, they are small movements. They are not large movements like abduction, adduction, flexion, extension. They are very small movements, and they are not under voluntary control. The person doing the abduction cannot control the rolling inside the joint. And what is funny is that, in manual therapy, sometimes when your patient come with frozen shoulder, for example, you've done your exercises, you've done your best, you have been able to increase the arm elevation. Maybe the patient come when the arm is just 45 degrees. You have been able to take it to 120 or 140 degrees, but you are struggling to get it to 180 degrees. Sometimes the reason why you are not able to get it to 180 degrees might be because the arthrokinematic component has not been restored. So as a trained manual therapist, that is where you will go. After that, you are not going to rely only on pendulum exercises. You will now go and glide the joints to improve the arthrokinematics so that the overall range of movement that you are looking for will be achieved. So that's what I'm saying on point number 4 here. These arthrokinematics are necessary for the normal physiologic ROM to be completed. I mean, point number 3 on this slide. Okay? And that is what that slide is also illustrating there for us. Now, what are the different forms of these arthrokinematics? There are 5, basically. There is rolling, there is sliding or gliding, there is spinning, there is compression, and there is distraction. All right, we'll be discussing them one after the other. But the diagram are also illustrating these 5. If you look at the first diagram here, the 2 green arrows are coming together at the joint. That means for compression to take place, the joints get narrowed because the 2 articulating surfaces come together. And the opposite is distraction. For distraction is represented by red arrow in that diagram. It means the 2 bones at the articulating surfaces are pulled apart and the joint surfaces increases. That is distraction. But the opposite is compression. The next diagram is the rolling. Okay? That means one bone is moving in a rotatory manner on top of a stationary bone. Okay? In manual therapy, there's always a bone that is moving, and there's another bone that is relatively stationary or fixed. I want you to bear this concept in mind. It will help you to understand what we'll be saying later on. That in every act of manipulation or mobilization, one bone is moving, the other bone is relatively stable. All right? Then we have sliding, which is like plane movement. All right, that's another one. It's also called gliding. Then we have spinning. Spinning is almost like rolling, but the bone that is moving is rotating about a longitudinal axis of the stationary bone. We're going to get it clearer in the next few slides. So we're going to look at each of those arthrokinematic one after the other.